Hello, my name is Ashanti Clark. The topic that I chose was experimental designs. I scored pretty low on this in this area on the Visi pre assessment, so I decided to further my knowledge on this subject. Um, Diving in, the first article that I decided to look at was the single case experimental designs to assess intervention effectiveness in rehabilitation. This study was conducted by Agata Krasny Puccini and Jonathan Evans, and it provides a comprehensive guide for rehabilitation professionals to design and implement single case experimental designs to evaluate the effectiveness of interventions. What was found is that single case experiment designs are useful for assessing intervention effectiveness in rehabilitation due to their flexibility, sensitivity, and ability to control for the individual variability. Um, some key elements were included in the article discussing single case experimental designs, which include baseline phases, intervention phase, withdrawal or reversal phase, and a follow up phase. The article also discussed different models involved in a single case experimental design, which include ABA design, multiple baseline design, and alternating treatment design. So, uh, things that were addressed in a single case experimental design included participant selection, data collection and analysis, visual inspection of data, and a statistical analysis. The authors emphasize the importance on internal validity, external validity, and social validity. The article concludes um, by providing a clear and practical guide for rehabilitation professionals to design and implement single case experimental designs, enabling them to assess the effectiveness of interventions and make data driven decisions. The second article that I am writing about or that I will be discussing, is the Family of Single Case Experimental Designs by Leonard H. Epstein and Jesse Dallery. Um, The summary in this study was that the single case experience design are a group of research designs used to evaluate the effectiveness of interventions or treatment on individual subjects. And the following types of single case experiments designs were discussed in this article. They also discussed ABA design, multiple baseline design, alternating treatment design, changing criterion design, and the multiple probe design. Um, each design is described in terms of its purpose, procedure, advantages, and limitations. This article highlighted the benefit of single case experiments designs, which included high internal validity, the ability to control for individual differences, and the applicability to the real world settings. The authors also discuss visual analysis of data, statistical analysis of single case experimental designs, data, and also external validity and generalizability. The article concludes by emphasizing the importance of single case experiments designs in advancing our understanding of behavioral phenomenon and developing the effective interventions. The last article that I'm going to discuss is called The Applied Hybrid Single Case Experiments, published, and this was in a systematic review that was conducted between 2016 and 2020. This was conducted by Renee Tanius and Ongina. Patrick Onkina. Um, and so this article discussed combining um, single case experimental designs with group comparison designs to evaluate the intervention's effects. And this is referred to as a hybrid single case experiment. Um, Characteristics that were the authors came up with were design characteristics, methodological qualities, and intervention effects. It was found that the hybrid single case experimental design was applied in various fields, including education, psychology, and healthcare. And most studies use a combination of ABA, single case experimental design, which ABA is an example, with group comparison elements, such as randomized controlled trials. Um, Intervention effects were generally positive, and they had moderate to large effect sizes. The authors discussed limitations for practice and research, including that hybrid single case experimental designs offer a flexible and more robust approach to reporting, to evaluating the interventions. And then future research should explore applications in diverse fields and populations. Overall, the article provides a comprehensive review of recent hybrid single case experiments research, highlighting the potentials of this design for evaluating intervention and informing evidence based practices.